Hello, everyone. My name is Abigail, and I am the health educator for the Pink Ribbon Place. Thank you for joining us for today's presentation. Today's topic is about the fear of cancer recurrence. Now, without further ado, I'd like to present to you professional clinical counselor Yesenia Ramirez.
Hello, everyone. My name is Yesenia Ramirez, and I'm here to talk about the fear of cancer reoccurrence. A lot of the questions that we get in therapy is the fear of reoccurrence normal? So it's obviously a complex and unexpected mix of emotions that accompany the end of cancer treatment. You may feel relieved and elated that it's over, but vulnerable and uncertain about what the future holds. For some people, hearing that they are free of diseases upon completing treatment may give rise to a significant level of worry and anxiety that the cancer will come back or occur. So, yes, it's very normal to feel like this. And one of the first things that we tell our patients is to identify triggers. We all have triggers as human beings, but for most people, worries about their cancer returning are often prompted or intensified by certain things. For example, the anniversary of your diagnosis, or a surgery, or news of a celebrity being diagnosed with cancer can stir up feelings of angst and evoke difficult memory of times you may rather forget. The anxiety surrounding follow-up exams and scans can also be overwhelming. And really, it's like a little check-in with yourself, to even hear that you have a planned appointment for another scan or anything like that. That can be very triggering. But you need to verbalize and identify those triggers so that way when you are triggered you can say, okay, this is just how I'm feeling and it's okay to feel like this. Have a plan. So remember to make a plan for coping with triggers you have identified. If you're nervous before a follow-up exam, for example, anticipate how you're going to get through the day of the appointment and possible the days leading up to it. So, with that in mind, if you need, emotional support, that might be inviting a family, a friend to be there with you, to be there in that following week at the house with you, or to be more present. Plan activities that will distract you from thinking about cancer, or write out a list of the things that have helped reduce your anxiety level in the past. Remember, this feeling will pass. The more though we internalize, the more we keep that anxiety inside of us. So just remember to plan activities so you have those distractions, and it can be as simple as logging in to social media and doing a yoga class with the Pink Ribbon Place, and just have these plans of activities that you can fulfill and not think about the anxiety. In therapy, we reduce anxiety with the STOP method. It's one of my most popular methods to introduce patients, and one that I utilize all the time. And literally, the STOP method is stop. The S is for stop. T is take a breath, 1, 5, or 10. Sometimes I need a few to get my thoughts together. The O is for observe. So I really want you to say to yourself, what am I thinking? And you could say, I am thinking that it's not going to go well, whatever, right? What am I reacting to? Because your body will have a reaction to your anxiety. What am I feeling in my body? You might feel the heat flash. You might even get dizzy. You might start giving yourself a headache, a tummy ache. But P is for pull back, put in some perspective, see the bigger picture. And you have to ask yourself, is this a fact or is this an opinion? How would someone else see this? And when you pull back and put that perspective, you could start figuring things out like, okay, no, it's my opinion. This is not a fact. This is not true that it's gonna be a bad day if I get this scan. How would someone else see this? Like if I were to tell my friend and they might tell me, friend, it's going to be okay. You're going to be good. P, the last P is practice what works. What's the best thing to do for me, for others, for the situation? When we have anxiety, unfortunately, the people that we love the most around us, sometimes we get very irritable and we isolate, and anxiety looks very different on different people. And so, practice what works for you and for others. Sometimes it might be to excuse yourself from the room if you feel like, I am so angry that I'm shouting out and I'm not being authentic to who I am. So the stop method worked phenomenal. And for those of you that want to kind of keep it, just kind of Google it, just type in stop method and take a screenshot. And you can always look at it on your phone, because sometimes when we have high anxiety, there's no logic that's coming in our brain. And let's talk about it. Family and friends can be your biggest supporters during your cancer treatment, but they may not realize you still have ongoing concerns after your treatment ends. Let them know that you welcome their continuing emotional support and encouragement as you adjust to life beyond active treatment. And I know sometimes, even in different cultures, we get very secretive about talking about our treatment. But what we do know in psychology, if you internalize that, it just builds more anxiety in you. It could also be comforting and validating to talk to others who've gone through the same thing you experience. The Memorial of Sloan Kettering offers online and in-person support groups where you can discuss your concerns, as well as a patient-to-patient support program, which can put you in touch with other cancer survivors to talk about your experiences and share concerns or anxieties you may have. Participating in an online community, such as the Pink Ribbon Place. It also offers cancer survivors the opportunity to discuss their fears among peers. The interesting thing that happens in these support groups and networks is that you can not only can receive support, but also can share your own experience and help others, which can be very therapeutic. And that's where you're in a good place of healing, when you are there to help others. And so you really drop your cortisol level, which creates stress and anxiety. And now you're coming from a different place to help others. So that is also huge. So please don't be shy or embarrassed to talk about it. And we have to look at wellness, focus all on wellness. We look at the whole person. There's complementary therapies such as like acupuncture. If you've never tried it, I was very afraid, but I loved it. So just try it. And maybe tell the acupuncturist that it's your first time, and so it's very, very relaxing. A massage, as well, if you've never received a massage, it feels great, and it just gives you a whole different state of mind as well. Music therapy, we know that music can really change our mood. If we put sad music, we get sad. We put happy and upbeat music, it can really change our mood. Guided meditation. This is another practice that, is not really talked about, but it's something in therapy that we do talk about, to meditate, to really redirect your thoughts and not to think about negative things. This can help you reduce your anxiety, make you feel more relaxed. Some survivors find comfort in spirituality and prayer. You just really need to find your healthy balance. And whatever that looks like, a healthy diet and physical activity also enhance overall well-being. You know, um, Back in the day, they used to believe that serotonin was built in the brain. The reality is serotonin is built, 90% of it is built in the gut. The gut is so important to our brain. So we need to remember, if we want to feel happy and healthy, we have to start by nourishing ourselves. So focusing on things like nutrition and exercise not only helps from a wellness and health perspective, but it also feel like you're regaining some control of your life, because When there's certain treatments, yes, we consent to treatments, but it feels very overwhelming. I don't know what's going on. But, the small things of a healthy diet and the physical activity, we feel like we're more in control of it. And if we start thinking in that mindset, it's easier for us to access that. And exercise, I can't stress that enough. So to start feeling better, if you start exercising 4 times a week for 20 minutes with the heart rate 120 beats per minute, you automatically reset your neurotransmitters. They give you feelings, so you get a whole new feeling state. And this is huge important when you start thinking, when you go into, we call it the cognitive distortions in psychology. But when we go into those negative thoughts, to remind ourselves, you know what, I'm going to go for a walk. You know what, I'm going to try yoga right now because I'm not in a good mental place. And with 20 minutes, you can reset those neurotransmitters. You could even break it up 10 minutes in the morning, 10 minutes in the evening, but just to start somewhere. Also, consider counseling. Therapists, psychologists, psychiatrists, we work with survivors to help them accept the fear of recurrence. It's a normal part of the cancer experience. They can help you develop strategies to cope with your fears and move forward with your life. If you're continuing to struggle with worries about your cancer returning, you may find relief. It's called cognitive behavioral therapy, CBT. We call it a modality in therapy. It's a form of psychotherapy that has been shown to help reduce anxiety and depression for people with cancer. It combines cognitive therapy, a type of talk therapy that helps identify and change self-destructive thought patterns that we just kind of talked about, those cognitive distortions, with behavioral therapy, which helps people recognize their unhealthy beliefs and behaviors and replace them with positive ones. So CBT is a tool you can use to bring negative or disruptive thoughts back to reality before they spin out of control. It does take practice, but it really does work. And be patient with yourself. It helps to know that for most people, fear recurrence gets better over time. I can't say that it goes away altogether, but as the time between follow-up care appointments increases, it often becomes more tolerable and occurs less frequently. It's all about a balance. And adding some of these tools that you learned today through the PowerPoint will help you create that balance, but it's really putting them in practice. We could talk about it all day, but really following up with yourself. And don't be shy to ask for professional help. So, and I really can't stress this enough. If you are crippled by powerful negative emotions like impatience and stress and depression and feeling just irritable at everyone and everything, sometimes the condition becomes so overburdened that we lose our focus and stop finding the patience from our inner reserves. And just don't be afraid to ask for help. I can't stress this enough. You can find many professional, qualified therapists to speak to. If you go to psychologytoday.com, you can even minimize them. If you want to just see a female, you can put in just a female, only through telehealth, if that's what you want. You can, narrow down only Spanish speaking. You can narrow down Arabic speaking. So don't be afraid to get out there and really ask for help, and maybe if you don't want to leave the comfort of your home, telehealth is the new way of age since COVID. So it's just to really, talk to yourself. What do I need right now? And you can hear the voice in yourself. And it might be that you need to talk to a professional, but that's okay. Thank you, everyone, for being here today. And if you need any more resources, check out Psychology Today. Thank you.
Thank you, Yesenia, and thank you all for tuning in today. The Pink Ribbon Place also has counseling services for individuals and families impacted by cancer in case you or a loved one is interested in counseling services. We will be having presentations like today related to various topics on cancer survivorship and wellness. So don't forget to follow us on our Facebook page at The Pink Ribbon Place for program updates and information on future presentations. Thank you all, and until next